This is a summary of the CPIC guideline for serotonin reuptake inhibitors and variation in the genes CYP2D6, CYP2C19, CYP2B6, HTR2A and SLC6A4. This video will specifically discuss the recommendations for sertraline. Videos covering the recommendations for citalopram, escitalopram, fluvoxamine, paroxetine, venlafaxine and vortioxetine can be found on the PharmGKB website and on the PharmGKB YouTube channel. This guideline was last updated in July 2023. Patients with decreased CYP2C19 activity and/or decreased CYP2B6 activity may be more likely to experience side effects due to increased plasma concentrations of sertraline. As a result, the guideline recommends that a lower maintenance dose and slower titration schedule be considered for CYP2C19 intermediate and likely intermediate metabolizers, as well as for CYP2B6 intermediate metabolizers. A dose reduction and slower titration schedule should also be considered for patients who are CYP2C19 poor or likely poor metabolizers, or patients who are CYP2B6 poor metabolizers. Alternatively, an antidepressant which is not predominantly metabolized by CYP2C19 or CYP2B6 can be selected. The guideline also gives recommendations for patients where both the CYP2C19 and CYP2B6 phenotypes are known. There are currently 39 defined alleles of CYP2C19, known as star alleles. More information about CYP2C19 star alleles can be found at the PharmVar website and in the CYP2C19 gene information tables on the PharmGKB website. Links to PharmVar and to the gene information tables are given in the description below this video. Star alleles are characterized by their rate of function relative to the star 38 allele, which matches the CYP2C19 genomic reference sequence, or the star 1 allele, which is commonly used as a comparator in functional studies. Both star 38 and star 1 are designated as normal function alleles. Diplotypes of CYP2C19 star alleles can be assigned to a metabolizer phenotype, as shown in this table and in Table 1 of the guideline. There are limited data available to fully determine the relative function of CYP2C19 decreased function alleles. As a result, patients carrying decreased function alleles are assigned as likely intermediate metabolizers or likely poor metabolizers. CYP2B6 also uses a star allele system. Further details can be found on the PharmVar website and in the CYP2B6 gene information tables on the PharmGKB website. Note that as more information becomes available, new star alleles can be added and the functional definition of some star alleles may change. An important caveat for all genotyping tests is that a normal function status is given to all alleles which are not detected in the assay. This can include rare increased function, decreased function, and no function alleles, which are not routinely screened for in some genotyping tests. This image is adapted from the PharmGKB sertraline pathway. A link to the original pathway is provided in the description below this video. Sertraline is metabolized by a number of enzymes, including CYP2C19 and CYP2B6. This metabolism inactivates sertraline. In patients with decreased CYP2C19 or CYP2B6 activity, the metabolism of sertraline is reduced. This increases the concentration of sertraline in the body and puts the patient at risk of adverse effects. These are the CPIC recommendations for sertraline by CYP2C19 phenotype. Patients with a CYP2C19 ultra-rapid metabolizer phenotype will have a small increase in metabolism of sertraline compared to normal metabolizers. These patients can begin sertraline therapy at the recommended starting dose. This is a strong recommendation. Patients with the CYP2C19 rapid metabolizer phenotype will have a small increase in metabolism of sertraline compared to normal metabolizers. These patients can begin sertraline therapy at the recommended starting dose. This is a strong recommendation. Patients with a CYP2C19 normal metabolizer phenotype will have normal metabolism of sertraline. These patients can begin sertraline therapy at the recommended starting dose. This is a strong recommendation. Patients with a CYP2C19 intermediate metabolizer phenotype will have reduced metabolism of sertraline compared to normal metabolizers. These patients can begin sertraline therapy at the recommended starting dose. A slower titration schedule and lower maintenance dose should be considered for these patients. This is a moderate recommendation. CYP2B6 metabolizer status, drug-drug interactions, and other patient characteristics should also be considered. Patients with a CYP2C19 likely intermediate metabolizer phenotype will have reduced metabolism of sertraline compared to normal metabolizers. These patients can begin sertraline therapy at the recommended starting dose. A slower titration schedule and lower maintenance dose should be considered for these patients. This is a moderate recommendation. Patients with a CYP2C19 likely poor metabolizer phenotype will have greatly reduced metabolism of sertraline compared to normal metabolizers and may also have an increased probability of experiencing side effects. A lower starting dose, slower titration schedule, and a 50% reduction of the standard maintenance dose should be considered for these patients. Alternatively, a clinically appropriate antidepressant which is not predominantly metabolized by CYP2C19 can be selected. This is a moderate recommendation. Patients with a CYP2C19 poor metabolizer phenotype will have greatly reduced metabolism of sertraline compared to normal metabolizers and may also have an increased probability of experiencing side effects. A lower starting dose, slower titration schedule, and a 50% reduction of the standard maintenance dose should be considered for these patients. Alternatively, a clinically appropriate antidepressant which is not predominantly metabolized by CYP2C19 can be selected. This is a moderate recommendation. CYP2B6 metabolizer status, drug-drug interactions, and other patient characteristics should be considered when adjusting dose or selecting an alternative therapy. There is no recommendation for patients with a CYP2C19 indeterminate phenotype. These are the CPIC recommendations for sertraline by CYP2B6 phenotype. Patients with a CYP2B6 ultra-rapid metabolizer phenotype will have increased metabolism of sertraline compared to normal metabolizers. These patients can begin sertraline therapy at the recommended starting dose. This is a moderate recommendation. Patients with a CYP2B6 rapid metabolizer phenotype will have a small increase in metabolism of sertraline compared to normal metabolizers. These patients can begin sertraline therapy at the recommended starting dose. This is a strong recommendation. Patients with a CYP2B6 normal metabolizer phenotype will have normal metabolism of sertraline. These patients can begin sertraline therapy at the recommended starting dose. This is a strong recommendation. Patients with a CYP2B6 intermediate metabolizer phenotype will have reduced metabolism of sertraline compared to normal metabolizers. These patients can begin sertraline therapy at the recommended starting dose. A slower titration schedule and lower maintenance dose should be considered for these patients. This is an optional recommendation. CYP2C19 metabolizer status, drug-drug interactions, and other patient characteristics should also be considered. Patients with a CYP2B6 poor metabolizer phenotype will have greatly reduced metabolism of sertraline compared to normal metabolizers and may also have an increased probability of experiencing side effects. A lower starting dose, slower titration schedule, and a 25% reduction of the standard maintenance dose should be considered for these patients. Alternatively, a clinically appropriate antidepressant which is not predominantly metabolized by CYP2B6 can be selected. This is an optional recommendation. CYP2C19 metabolizer status, drug-drug interactions, and other patient characteristics should be considered when adjusting dose or selecting an alternative therapy. There is no recommendation for patients with a CYP2B6 indeterminate phenotype. The recommendations for sertraline by CYP2C19 phenotype can be found in Table 3 of the guideline publication. Table 4 of the guideline publication shows the recommendations for sertraline by CYP2B6 phenotype. Table 5 in the guideline publication gives recommendations for sertraline and combined CYP2C19 and CYP2B6 phenotypes. This guideline has been annotated on the PharmGKB website. This includes a drop-down menu where a specific recommendation can be given for given combinations of alleles. This includes implications for the patient's response to sertraline, the appropriate recommendation for the specific metabolizer phenotypes, and the strength of that recommendation. Remember that variation in other genes, in addition to demographic and clinical factors, including concomitant medications, can affect treatment. It remains the responsibility of the clinician to determine the best course of treatment for a patient. CPIC and PharmGKB assume no responsibility for any injury to persons or damage to persons or property arising out of or related to any use of CPIC's guideline or for any errors or omissions. The guideline itself and supplementary information are freely available on the PharmGKB and CPIC websites. You can access relevant pages using the links in the description below this video.